Leptospirosis is a significant yet often overlooked zoonotic disease caused by bacteria of the genus Leptospira. This condition is primarily found in tropical and subtropical regions but can occur worldwide. The bacteria are typically present in the urine of infected animals, especially rodents, which serve as the main reservoir for the disease. Humans can become infected through direct contact with water, soil, or food contaminated with this urine, as well as through contact with infected animals. The transmission routes illustrate the importance of sanitation and public health measures in areas where the disease is endemic. Notably, activities like swimming, wading, or working in flooded areas can increase the risk of acquiring leptospirosis. Certain occupations, such as farming, sewage work, and veterinary medicine, are associated with a higher risk of exposure. The clinical presentation of leptospirosis can be quite variable, ranging from mild flu-like symptoms to severe, life-threatening illness. Common initial symptoms include high fever, headache, chills, muscle aches, vomiting, and diarrhea. After this initial phase, there can be a sudden improvement followed by the development of more severe symptoms. In some cases, this can progress to a more serious form of the disease known as Weil's disease, which can cause jaundice, kidney failure, bleeding, and respiratory distress. The diagnosis of leptospirosis can be challenging, especially in the early stages, as symptoms are similar to other infectious diseases. Laboratory tests are crucial for confirming the presence of Leptospira. These include microscopic agglutination tests, polymerase chain reaction tests, and serological assays, which can detect antibodies against the bacteria. Treatment for leptospirosis is typically based on antibiotics. Doxycycline is a common choice for uncomplicated cases. However, intravenous penicillin or ampicillin may be required for severe infections. Early diagnosis and treatment are critical for a favorable outcome, especially to prevent complications. Without treatment, severe leptospirosis can lead to significant morbidity and mortality. Prevention is key in controlling the spread of leptospirosis. Measures such as reducing exposure to contaminated water, wearing protective clothing while working in high-risk areas, and controlling rodent populations can significantly decrease infection rates. Vaccination of livestock and pets, particularly in areas where the disease is endemic, can also help protect animal populations and, consequently, reduce the risk of human cases. Public health education plays a vital role in preventing outbreaks. Awareness about the risks and symptoms of leptospirosis can empower communities to act quickly if they suspect an infection. It's essential for people living in or traveling to high-risk areas to understand the disease's transmission dynamics. In conclusion, while leptospirosis is a preventable and treatable disease, it still poses a significant threat, especially in vulnerable populations. By enhancing awareness, improving sanitation, controlling animal reservoirs, and implementing effective public health measures, we can reduce the burden of this potentially serious infection. If you suspect you've been exposed or are experiencing symptoms, seek medical attention promptly. Knowledge and vigilance are our best defenses against leptospirosis. Thank you for watching this overview of leptospirosis. If you found this information helpful, please consider subscribing for more educational content on infectious diseases and health topics. Stay safe and informed.